So a good day to you all our viewers. So my name is Sancho and I'm introducing to you the Big Four Anatomy series. So as you can see, this one is a new channel, and today I'm sharing with you the elbow joint, giving you the tips and tricks on how you can memorize better and probably excel in your MCQ exams. So buckle up, and as I will be sharing with you the nerves, the muscles, everything, I'm trying to simplify it for you guys so that you can pass and memorize and be the doctors you want to be and be the future paramedics that you want to be, nurses. So that let's kick it. So let's start the elbow joint. So the elbow joint is forms between the humerus and ulna and the radius. So as you can see, this one is the trochlea. It articulates with the trochlear notch on the ulna, and this one is the capitulum on the humerus. It articulates with the head of the radius. So I'm going to start. So as you can see, these articular surfaces are surrounded by hyaline cartilage. So this makes it a synovial hinge type of a joint. So hinge with me in the sense that it moves like a door, as you can see in the diagram. The joint is surrounded by a capsule and is made up of ligaments. The ligaments are the lateral collateral ligament, or similarly the radial collateral ligament, and we also have the medial ligament, or the medial or the ulnar collateral ligament, and we also have the annular ligament. The annular ligament is the one that wraps around the radius to the ulna, so it attaches the radius, squeezes it tight to the ulna. So as you can see, it attaches from the anterior margins of the ulna on the radial fossa to the posterior margins of the radial fossa. So this is the annular ligament for you. This is clear that we have a synovial membrane, and you have to know what I need to know about the synovial membrane is that it is continuous with the synovial membrane of the proximal radio ulnar joint, and it covers the fat pads, as you can going to see in the olecranon fossa and the coronary fossa as well. So it also covers those joints. It covers the capsule, the fat pads in the olecranon fossa and the coronary fossa, and it is continuous with that one of the proximal radio ulnar joint. And move on to the movements of the joint. So the movements, we have already said it's a hinge type of a joint. So this flexion and extension, we have to know the flexion is done by the muscles that we have: the brachioradialis muscle, the brachialis muscle, the biceps brachii muscle, and the pronator teres muscle. These are the muscles that perform the flexion of the elbow joint, like this. And we move on to the extension. Extension is done by the triceps muscle and the anconeus muscle, and fossa. So the cubital fossa is a small depression, you know it, that lies in front of the elbow joint, and it is bounded laterally by the brachioradialis muscle and medially by the pronator teres, and it's like a triangular. So the base of the triangle is an imaginary line that connects the two epicondyles, the medial and lateral epicondyles of the humerus. So it is made up of a floor, and the floor is made up laterally by the supinator muscle, and we have medial. It is formed by the brachialis muscle, and the roof of the fossa is formed by the skin and fascia, which is reinforced by the bicipital aponeurosis. The bicipital aponeurosis of the of the biceps brachii muscle. So this is the boundaries in the roofs and the floors of the cubital fossa. So let's go to the contents. So the contents, we have the deep contents and the superficial contents. So on the deep contents, from medial to lateral, you have to know the order. So I've created there's a mnemonic. I switched it to English so that we can cater for everyone. So it's called "My Boy Took Razor," which means which literally means my, which represent the medial nerve, the most medial, and the boy, the bifurcation of the brachial artery, which bifurcation means splitting into two, and is turning into the radial and giving us the radial and the ulnar artery. So the bifurcation is one of the content of the cubital fossa. And we have the "My Boy Took T," will represent the tendon of the biceps muscle. So it's tendon of the biceps, and the razor is the radial nerve and its deep branches. So it's a simple mnemonic you can use. So you have to know the order from medial to lateral. So on the superficial contents, we have the supratrochlear node. Supra means above. Trochlear is a trochlea, the part of the humerus. So it lies in the upper part of the fossa, and it's above the trochlea. It is a lymph node, as I mentioned, the supratrochlear lymph node drains blood from the third, fourth, and fifth finger and the medial aspect of the forearm, and it drains into the lateral group of lymph nodes in the axilla. Yeah. So the afferent lymph nodes come from the third, fourth, and fifth finger and the medial aspect of the forearm and to the supratrochlear node and drains into the lateral group of lymph nodes in the efferent lymph node in the axilla. So this is the supratrochlear node for you. And we also have the median cubital vein. It's also a very important aspect of the superficial contents of the cubital fossa, and they usually used in the clinical setting for drawing blood. So as you put a diagram, as you can see on the diagram, this one is a median cubital vein, just a bridging between the cephalic and the a bridging vein between the cephalic and the basilic vein as they turn into the brachial vein. So there it is for you. And we also have the skin and the nerves, something like that. They're all superficial. So this one was the cubital fossa for you. We have to know the relationships of the elbow joint. So the elbow joint, anteriorly we have the brachialis muscle, the brachial artery, the tendon of the biceps, as well as the median nerve. These ones lie anteriorly, as you have seen in the cubital fossa. These are basically the contents of the cubital fossa. And posteriorly we have the triceps muscle, of course, and medially we have the ulnar nerve that passes behind the medial epicondyle and crosses the medial ligament. And laterally we have the common extensor tendon as well as the supinator. Thank you very much guys for watching this video. I hope you liked it and I hope you understood. If you happen to like this video, make sure you subscribe so that you don't miss out on the next